everyone, and welcome back to my channel. Hope everyone is doing great, guys. Today's video we want to talk about sore vagina after sex. I'm sure one in however many people have had painful sex or soreness after or during sex, and I just wanted to cover this with you so that you just double check next time it happens, and then you know how to kind of go about it. But yeah, right now I have 20 courses, potential 20 courses of the reason why your vagina may be sore after sex. So guys, let's head straight to the video. So guys, here we go. So the vagina may become sore during or after sex for several reasons. So for example, causes may include things like the friction, infection, or you could have allergies or trauma, etc. We're going to dive into these causes and explain a little bit more just so that you can identify next time what it could be, and then you know how to treat it, and not just leave it hoping that it will go. All right. So treatment may vary depending on the cause of the soreness. If the pain is due to a psychological reasons, guys, such as psychologically induced vaginal tightening, counseling may be a good option. So there's quite a few things. So I'm just gonna kind of list them out to you. So one of the typical main causes of soreness during or after sex is lack of lubrication. Lack of lubrication, guys, is imperative. You do not want to have sex dry. You do not want to do that because it will rub, it will cause friction, and it will cause a lot of pain. Now, why are you having sex when you are dry? I mean, if you are turned on, then you should have a form of natural lubrication going on both sides. But if you are dry, maybe due to medical whatever, you are dry because you're not turned on, you're not feeling anything, don't even go there, because you are going to experience pain down below. Okay, so lack of lubrication, like I said, is a common cause of pain during and after sexual intercourse, which is, yeah, it's painful, guys. So do not even think about doing that. A vagina creates a lubrication naturally, like I said, it both to clean itself when a person is aroused. So your vagina is a self-cleansing area. Anyway, so however, although vaginal dryness is common, it is common, especially after menopause, low estrogen levels can cause it to occur at any time. So it's all, when it's dry, also based on your estrogen level as well. So if you don't have any lubrication when you're having sex, use the lubrication gel that helps to moisturize and, you know, lubricate the place before you dive in, you know. The second one is a general lack of arousal. I mentioned that earlier as well. In some cases, a person may not feel in the mood to have sex, or may not be fully prepared to have sex with a partner. It's like, okay, he wants to do it or she wants to do it, so let me do it to please her, or I'm bored, let me do it. There's no point doing it, guys. If you are not interested, if you're not aroused, if you're not feeling it, what is the point? What is the point? The point is to enjoy what you're doing. So if you're not feeling it, guys, you are wasting your time. Okay. The third one is low estrogen levels. Yet again, I mentioned that earlier. Estrogen levels fluctuate significantly over the course of a person's life, such as during puberty, menopause, and pregnancy. These fluctuations can result in low estrogen, which may cause symptoms such as pain during sex, and also like hot flashes as well, fatigue, or mood shifts as well. Estrogen plays a vital part in, you know, your hormones as well. And then the fourth reason why you may have soreness during or after sex is your menopause, guys. Menopause leads to a vaginal dryness, like I said, a tighter vaginal opening, and the thinning of the vaginal wall. So this lack of lubrication and flexibility can cause painful sexual encounters. So always use lubrication when you feel dry down below. Okay, make it easier for you, make it easier for the guy, because you are both going to be feeling that friction, that kind of burning sensation as well. A person should talk to the doctor about potential treatment options, and also use lubricated condoms as well, or lubrication during sex. Okay, now the fifth one, guys, that I want to concentrate on is previous injury. If you've had injury down below, you are just erupting something that's just going to cause you pain. So sustaining injuries to the vagina may cause sex to become painful or uncomfortable. Okay, for example, giving birth to a large baby may tear you down below, especially if you've done it naturally. It would tear the vagina and cause scar tissue to form, so resulting in pain during intercourse. A person should talk to the doctor as usual to deal with that, because before you engage in any kind of intercourse down below, guys. Some people are allergic to latex allergies. Okay, latex allergy can cause burning, itchiness, and pain if a partner uses a latex condom. I know people who are allergic to stuff like that. They're not making it up. There are people who are generally allergic to latex condoms, guys. There's alternatives that you can use, but I will look into that as well to see what those alternatives are, and obviously speak to your GP. 7 is skin conditions, guys. Ulcers near the vulva in the women, skin cracking around the vulva, vagina area in the women. That can also be a very painful experience. This cracking could result in pain during sexual intercourse. Yet again, a person would need to avoid certain irritants and prevent the skin from reacting to certain things, so that it doesn't cause a reaction down there, and then it wouldn't cause painful sex. Okay. This one here, it says vulvodynia. Yeah, so that's the condition that causes pain in the vulva. The pain tends to be located at the opening of the vagina as well. So look out for that. Any pain you feel, guys, just, you know, get it flagged, you know. Ovarian cyst is another one. These are the fluid-filled sacs that grow on the ovaries. They can cause several symptoms, including pelvic floor pain, pain during sex, and also difficulty in urinating as well. If you wait and sit on it, it's not going to go away. You need to treat it. The other thing is also called the vaginismus. Okay, this is what I tried to pronounce earlier and I couldn't. It causes the muscle between the vaginal opening and opening of the anus to spasm. So all these, you can have physical therapy, vaginal dilators, relaxation exercises, and medications can treat some of these issues as well. The other one is vaginitis. That is a bacterial or a fungal infection that causes inflammation in the vagina as well. Produces smelly discharges, itchiness, and pain, guys. Do not ignore that. You need antibiotics and also antifungal if it's a fungal infection. Okay. You also have the UTI, which is a urinary tract infection. It occurs when the bacteria from the anus or skin travel up to the urethra into the bladder or the kidneys. This is where you wipe from your bum into your vagina. You should be wiping from your vagina out to your bum, because when you wipe from your bum to your vagina, you are bringing the feces and the dirt into the vagina, causing infection. Okay, guys. So speak to your doctor. UTI, obviously, frequent urination, pain, burning sensation, blood in your urine, a lot of symptoms that is very uncomfortable. You don't want to go there at all. Go to the doctor, they do tests, they give you antibiotics to try and clear that up as well. And then you've got bladder inflammation as well, which is a chronic condition that causes an irritated or inflamed bladder wall. Some common symptoms include a feeling of pressure or pain around the bladder or pelvis, and you may need frequent wee as well, and pain during sex. Okay, so please get this checked out. You can also have prolapsed bladder, which is also another one. The pelvic floor muscle and tissues provide support for the bladder. So over time or due to injury, this support can weaken, causing the bladder to push through into the vagina. Yeah, so get that sorted out. And then you've got chlamydia as well, which I've spoken about, sexual intercourse, having all these infections. Be very, very careful. Herpes, guys, is another form of STI that can cause open sores and develop in the vagina. Gonorrhea as well is another one. Both men and women can get that. Anyone can get it. Endometriosis is where, the inner lining of the uterus grows outside of the uterus. So that also causes pain when you're having sex. It causes infertility as well. Bleeding and spot in digestive systems, affect the pelvic area, pretty much a bunch of stuff, guys. The things that this body has to go through, do not take it lightly, honestly. And unfortunately, if you have been previously sexually abused, that can have a lot of effect as well on your sexual intercourse. But in summary, guys, do check these things out. Like I always say, do not sit on it expecting it to just clear up. See your doctor if you need to. Get the test done, get urine test done, blood test done, get your antibiotics, get your healthy diet in, do your exercises. Do what you need to do to get rid of all this stuff. Okay? All this stuff. Free advice from Auntie Yayra. Okay, yeah, if you have any more you want to add to what I already have, please, guys, we are doing this together. Pop it in the section down below. If there's any topics you want me to cover, guys, honestly, let me know. Email me, or just pop it in the section below, in the comment box. Do whatever, guys. Talk to me. We are here to figure everything out together. So I hope that little information helps you guys out. And yeah, once you get it cleared up, guys, you're gonna enjoy lovemaking. Okay, so on that note, guys, I'll see you in the next video. Stay blessed.